Plantar fasciitis is a common and painful condition affecting the bottom of the foot. It occurs when the plantar fascia, a thick band of tissue that runs across the bottom of your foot and connects your heel bone to your toes, becomes inflamed. So what are the causes? So plantar fasciitis is a condition in which there is persistent pain associated with degeneration of the plantar fascia as a result of repetitive micro tears in the contracted fascia. These are some of the mechanisms that can cause this injury. So overuse. So activities that put a lot of stress on the heel and attached tissue, such as running, walking, or standing for long periods, can lead to inflammation. High impact activities. So sports or activities involving running, jumping, or sudden stops and starts can overstrain the plantar fascia. Biomechanical issues. So structural foot problems like high arches, flat feet, or abnormal walking patterns can contribute to excessive stretching and stress on the plantar fascia. Improper footwear. So wearing shoes with poor arch support, inadequate cushioning, or worn out soles can fail to provide the necessary support and shock absorption. So what are the signs and symptoms of plantar fasciitis? So normally there's initial onset of pain. Intense pain during the first steps after walking or after a period of inactivity. Pain that reduces with moderate activity but worsens later during the day or after long periods of standing or walking. Now, signs of plantar fasciitis include tenderness on palpation of the plantar heel area, particularly but not always localized around the medial calcaneus tuberosity, limited ankle dorsiflexion range within knee extension, and a positive windlass test, so reproduction of pain by extension of the first metatarsal phalangeal joint, tightness of the Achilles tendon, and an abnormal walking gait or limping as well. Now, there are certain risk factors that can increase the risk of developing plantar fasciitis. So the first one is age. So plantar fasciitis is most common between the ages of 40 and 60. The prevalence estimates ranges from about 4 to 7% in the general older population. It accounts for about 11 to 15% of all foot complaints, which require professional treatment. And it occurs in about 8 to 10% of regular runners as well. The second risk factor is occupation. So jobs that require long periods of standing or walking on hard surfaces, such as teaching, factory work, retail, that can increase the risk. Foot structure, so having flat feet, high arches, or an abnormal walking pattern can affect the distribution of weight and increase the stress on the plantar fascia. Also weight, so excess weight puts additional pressure on the plantar fascia, contributing to its strain and potential inflammation. And exercise habits, so engaging in high impact sports or suddenly increasing the intensity or duration of physical activity can overburden the plantar fascia. So there are several treatment strategies that can be used to help reduce the pain and inflammation associated with plantar fasciitis. So the first one is rest and activity modification. So reducing or avoiding activities that increases the pain and allows the plantar fascia to heal. So cross-training with low-impact exercises like swimming or cycling can maintain fitness without stressing the foot. You also have ice therapy, so applying ice to the affected area for 15 to 20 minutes several times a day can help reduce inflammation and pain. Stretching and strengthening exercises. So you could use calf stretches. So stretching the calf muscles can help relieve tension on the plantar fascia. You can also do a plantar fascia stretch. So pulling the toes back towards the shin to stretch the fascia. Strengthening exercises, so strengthening the muscles of the lower leg and foot can help provide better support to the arch. Orthotics and footwear, so using custom orthotic devices or over-the-counter arch support can help distribute pressure more evenly across the foot. Wearing shoes with good arch support and cushioning is crucial. You could use night splints, so wearing a splint that stretches the calf and arch of the foot while you sleep can actually help lengthen the plantar fascia and reduce morning pain. Even though we can't prescribe, patients could use anti-inflammatory drugs, and that can help reduce pain and inflammation as well. You could also use more therapy, so provide specialized treatment plans that includes exercise, manual therapy, and other modalities to help reduce the pain and to improve function. You could use some more advanced treatments if you wanted to. You could refer them to a medical professional to have a corticosteroid injection. You could use shockwave therapy as well. So this is a non-invasive treatment that uses sound waves to stimulate healing in the affected tissue. So plantar fasciitis can be a painful and condition that can really affect the patient's lifestyle. But understanding its causes, risk factors, and available treatments, that can significantly aid in managing and overcoming it. By addressing contributing factors and implementing effective treatment strategies, individuals can achieve relief and prevent reoccurrence, enabling them to maintain an active and healthy lifestyle.